Welcome to the show. We are the Authentics.
I'm Jay Binkowitz, and we're ready to dive in to some good conversation.
I'm Dr. Essence Johnson, and this is The Authentics.
Hey, good Monday evening, everybody. It's The Authentics. How are you?
We're doing great.
Excited.
Doing great.
Well, we're looking forward to having a lot of people listen to this conversation and participate by typing in your Facebook comment section or in the YouTube comment section or in the LinkedIn comment section, and we'll monitor those. We'll have chats with you. We all know that optometric exam fees and compensation by payers have been held down for decades. And tonight, the Authentics are looking to talking about this more broadly. And hopefully you're going to have a conversation that's not only going to help you understand how we got here, but maybe help you understand where to go. Before we get started, we want to make sure that you take the opportunity to hit the subscribe button on YouTube if you're on there so you can get updates on future videos and live streams. But with all that being said, let's start the conversation. One of the things that happened, I guess I'll go to you, Alan. We were talking about this a few weeks ago, and you said, it makes me crazy when I see advertisements, ... Tell us the story.
Oh, so yeah, there's a company out there who has a history of offering free eye exams, and we all know the challenges and the feelings that we have around that and how that devalues us and our services as optometrists. But the new commercial I saw said the quote was, it's something like get a free eye exam with a purchase of a pair of glasses, and then some owl goes, that's a $50 value. I was just like, I don't know what's better. Like, I think I liked it better free. Yeah, it hurt me to see that, and I think everybody knows what I'm talking about. It was just that's I think how we started this off and decided to have this conversation.
Yeah, I mean.
Oh, and the owl, by the way, it was an owl version of Norm Macdonald.
Oh I mean, some of you've been around, Ed, you've run, a lot of businesses, data business. Are ODs not standing up for themselves? What is it about?
I think it's more ODs don't focus on how to make more money most of the time. We all know that eye exams and the reimbursement for eye exams is a very important part of running a practice. But, I personally think ODs are in a very unique opportunity to sell glasses and contact lenses. So, I think it's just, they don't focus on it. I mean, in my 44 years, that's certainly what I see, whether it was OfficeMate or GPN. There's many, many opportunities to make money. I think, you have to look at what those opportunities are and go after it.
Is this really an OD question, or is it a business practice question that the industry is allowing some folks to skate through the system and advertise free eye exam with the purchase of eyewear, or maybe a trip to Aruba, or maybe a new lease on a car, however, whatever they're putting in their promotions. But really, it's about business practices and some folks in the industry who are ultimately diluting the value of optometry. Isn't it more about that?
I think, Jay, it's I've seen the commercials that Alan's talking about, and it burns me up. And I'll tell you, I think it's about portions of the corporate part of our profession, which are trying to drive their businesses, which is understandable. But we're allowing them to define our profession. We're allowing them to decide what the value of an eye exam is worth. And so to the consumer who's simply watching the commercial, you see that ad, and now you start to anchor to that number. Oh, that's what an eye exam is worth. And so when they call my private office and I charge 4 times that for an eye exam, then suddenly I seem like I'm outside of the normal number. But the challenge I have is I can't run TV commercials, and I wouldn't. It doesn't make sense for me. I can't collude with my colleagues and run TV commercials about the prices of our eye exams. And so we're kind of at a little bit of a competitive disadvantage from the megaphone side of the profession, which is we don't have the ability to get to redefine the price of an eye exam. So we have to sort of do it one at a time or as individual owners.
That's so true. And with the dilution taking place of the value, also comes dilution of the definition of an eye exam, right? So by putting out there eye exams are free, it not only dilutes the value, it dilutes the importance of a full eye exam is, and ultimately the consumer is confused as to what services they should or shouldn't expect.
One of the comments I got when I posted about this show on ODs on Facebook was, and a doctor, and he was right to some degree, said, well, you don't have to, he was referring to the vision insurers that we might take in our independent practices. Well, you don't have to take them. You're choosing to take them. And on some level, that's right. But again, this, like Mick had said, this is so widespread, and it's tricked down into companies that have seen as an opportunity to, name our price for us. And so it's on different levels. It is. And it all boils down to something that I've always referred to as OLSE, OLSE, optometric low self-esteem, where people will do anything to put a butt in their chair, even devalue themselves. And it's important to understand, yada, yada, chair cost, how much does it cost to keep your lights on, and what's that really worth to you? And what else could you do with that money to drive higher independent paying customers into your office? These are all topics. It's not a simple answer. These are all things that add up to the devaluing of our services.
I think that also plays a role in students wanting to be optometrists. I mean, I graduated a few years ago, and I feel like this has been going on since then. And it keeps pushing people to say, well, when my son or daughter is ready for school, I don't want them to become an optometrist because of this. So I think it not only devalues our profession on the patient side, but on the next generation. And are we going to encourage our children to become optometrists to deal with this and to say, I saw the same ads, I see them on Facebook. I don't have cable TV, so I don't actually see commercials. So that was new to me. But I think it also is pushing, how do we view ourselves? I don't know why we have it, and it
a lot of
makes
this
me really sad.
Yeah, a lot of this must be regional. Where I live in Southern California, we see no free advertising. We see no free eye exams. Mick, do you see any of it down in San Diego?
Yeah, and I think the only time I would see it would be on cable, so it's more of a national audience. I do know that some states do prohibit marketing free eye exams, and my understanding is California is one of them. I have seen some of the language in the law, which I thought was a little bit ambiguous, but I think that there are states that try to prohibit this. But how much of that ever gets enforced? How much of it ever gets? There's certainly not the free eye exam police floating around out there trying to stop companies from making claims.
And that's so true, right? It's just good intention without any accountability. My understanding, which we've all discussed before, is that the Office of Inspector General expressly said that it's illegal to charge any patient different than you charge a Medicare patient. And in a rare occasion, there has to be a specific reason documented, and a promotion or an enticement would absolutely be illegal. But who's there to knock on the door and say you can't do that?
Before Essence, I see you're unmuting. I want to say hi to Eric and Ansel, who are both watching live and sending in chats. Please send them on. Essence, I'm sorry. Go ahead.
No. Hey, Eric. Hey, Ansel. I wanted to go back to the point that Jay had made earlier. I think we always see it from, the practice side, the OD side of it. But I think it's also important to acknowledge just as a whole how this information does get interpreted or misinterpreted by our patients. And being someone who spent a majority of her practice, you know, as an employed physician in many different factors, the way that we give out that messaging works sometimes against us, where we're putting it out there to get patients in the door. But there's been many times when I've worked in a private practice or in a hospital setting, then patients are like, well, I wanted to come see you because I got that free eye exam from the big box store or the other places. So they're not as confident in the care that they're receiving. And there is this bias or stereotypes about doctors and kind of different practice types that we also kind of perpetrate ourselves a lot of times, that doctors in X practice versus Y practice is better, when the overall messaging, regardless of cost of exam or cost of materials, which definitely can be dictated based on location or geographics or, you know, just your patient audience, is not, it should not be equivalent or equate to the quality of care that you're receiving at a hospital versus a private practice versus another type of corporate entity as well.
I wonder if you could talk to me about language. I have a point of view about language. We've gotten suckered into talking about routine eye exams. And the word routine, I think, has hurt optometry. There isn't such a thing as a routine eye exam, but we went down a slope over the last 50 years of, you know, being beholden to entities that pay us sometimes for care, saying that we want to fit the care you give into a box. In essence, it goes right along with what you're saying. The public doesn't understand because we've done a terrible job of informing them about what it is we do. Now you see entities like our, you know, AOA and others now talking about the annual eye exam. And even then, the clinical practice guidelines that are now peer reviewed and, you know, everything else don't really say that most healthy people need to be in every year. We just keep driving this. Is the language hurting us?
Language always hurts. You have to, you know, the words you use are very important on so many levels. I mean, I don't even know where to start with that. It's a great point, Scott. Not that it's just such a big topic. It's a whole nother show.
Yeah.
No, I agree with that. I think where we see it show up a lot is when patients, where we want to bill patients medically, and they're like, oh no, all you need to get is my vision insurance. You know, there's a lot of confusion on the why we are doing more than this routine, annual, comprehensive, all of the different things that we said, or being in a hospital setting and people going to an outside practice, you know, they're like, I didn't get this comprehensive exam where they didn't dilate me or do pressures or, you know, check vision. And sometimes you're like, they didn't do any of that stuff when you went, they just gave me glasses, you know? And I think the language definitely leads into what patients remember about the exam, you know, how they're judging or classifying a practice. But I don't think that we always do a very good job of being kind of standard in our standard of care.
Yeah, perfect example. That was right spot on. And perfect example that I thought of while I was listening to Essence is with fitting, contact lens fittings. Okay, it's a fitting. Who's going to pay for a fitting? I'm fit. They work. Just give me my new script, right? Like,
well, Alan, I don't know if you're fit, but it's equates to, you know, being fit for a shoe. Maybe, I don't know. Fitting is such a weird word, right?
I can tell you right now, I am not fit, but I'm not fit for anything. But what I'm telling you about is fitting a patient, and it's, you know, that's a perfect example of how contact lens therapy is the word I try and use, although I still find myself dripping out fitting for obvious reasons. But yeah, the words are so important.
Yeah, you know, I was just thinking too, you know, the whole topic of tonight's conversation is about ODs being undervalued. And one thing that we're working hard on in my practice is communicating the value that we deliver to a patient every time they come in. And that's something that if you get caught up in being busy, it's very easy to do a lot of things, not communicate all the things you've done. And the patient leaves and their perception is, oh, I just got a glasses prescription. Well, actually, we did a lot more than that. But if we never take the time to explain to them the value that we're delivering to them, then it's easy for it to get lost. Because when I go to the dentist, I'm sure they're checking lots of things that don't get communicated to me. But I leave thinking, oh, I just made sure I didn't have any cavities today. And maybe that's good enough. But if I'm wondering if there was a higher level of care, I'm not sure if there was, because it wasn't communicated to me.
You know, Rick and Carla Pascucci, as a message that came in, said that the word comprehensive eye exam or phrase is better, which I tend to agree with. And Dr. Ansel Johnson's been talking about the same thing, right? That patient by patient, you have to explain to them, as he writes, right, the risk of hypertension, diabetes, family history, and making sure that we control the message. But we've had 100+ years to do this, and the public still undervalues us. So isn't it really on us?
Well, and it's the same thing. How many times I've heard in practices that, that folks are going to go see a real doctor. And listen, I'm not an OD, and I want to jump out a window when I hear that. I'm like, oh my God. When someone says, I want to see a real doctor, that's just, it gives me hypertension.
Well, I mean, just, on top of the messaging problem we already have, we have another profession, an ancillary profession to us, ophthalmology, that actually has a completely different message about frequency of eye exams and delivery of care. So that certainly doesn't help our messaging when we have a certain set of recommendations as far as how often eye exams should be performed, when it so greatly differs, and ophthalmology often gets a lot more press than we do in some of the higher profile publications. And so that just sort of compounds the communication challenges that we have.
It'd be an interesting challenge for some of the organizations, associations in the industry to really collaboratively develop national campaigns to do exactly what we're talking about.
And everything we're talking about right now pertains to one-on-one eye exams. What about teleoptometry? And you talk about, Scott, you talk about language and how we describe. In the world of teleoptometry, it's a whole different generation of discussion going on. And how does a patient perceive a remote eye exam compared to an in-person eye exam?
We talk about eye exams, comprehensive eye exams, as the flagship offering. But I heard one of you say medical optometry. I think that was you, Essence, that we're delivering this medically focused care. And sometimes practices have to transition from routine comprehensive care to medical comprehensive care. And we have to walk this dance with insurance, and whether the patient will understand that we've shifted to talking about their floaters as a potential sign of a medical condition when they came in because they said their glasses needed to be updated. It's too nuanced. So what we've done is we've got all these CPT codes that every other health profession, you talked about an ancillary health profession like ophthalmology, we use those to define our services until we don't. And I think the payers have put that on us, right? They're paying for not a CPT coded exam, but a comprehensive, pardon the word, routine exam. So it's also that influence, right? The payer.
Are we in a vicious cycle? I mean, the name of this talk is ODs are undervalued. And at the same time, we're talking about that. We're talking about ODs being undervalued. What came first, the chicken or the egg here?
It's funny that you said that, Alan, because as we keep talking, it's one of those situations, just anything, that it has been a cycle of kind of trauma. And some of our undervaluing comes from ourselves too. Like, we sometimes don't know how to value the care that we're giving, or to change the language that is out there. And we find ourselves falling into some of those traps that are, again, perpetuating those same stereotypes. Because when we've been told you're not a real doctor, or all you should be able to do is, or just check glasses and maybe we get a little bit of context, I think some of that has kind of been integrated into our fabric and passed on as this generational curse in our industry. So it is a good question to ask, like, how do we break that cycle? We always look outward or at the payers or blame the other companies, the commercials, but we are also, kind of lending into the abuse of ourselves and our profession.
I agree. I always wonder why optometrists are so fearful. We're afraid of losing our patients. We're afraid if we don't take every plan under the sun that I'm going to lose patients to my colleague across the street. And I don't think that's regional. I know that maybe the commercials are regional, but I know that's the same in Connecticut or California. So I don't know where that fear, that FOMO almost of missing out on these patients, but then we also have this low self-esteem, feeling beat down that I can't get ahead. I can't provide the level of care I want to because I feel like I need to take these plans. So I think that's a vicious cycle too, is I think most of us deep down know exactly what we want. If we could start over and build, I always talk about building an authentic practice. If we could build that authentic practice of our dreams, most of us know exactly what it looks like. And I think anyone listening, if you are listening, share in the comments, what would you do? What would be your first step? If you could do anything to build your authentic practice, what would that be? And I think a lot of us, I could probably guess 3 of those, what they would be. So I think we just have to take that step and all kind of realize we're not gonna go out of business. We're not gonna lose all of our patients. And if we do lose some of them, that's okay, because those might be those patients that don't value the care that we provide anyway.
That's great, Jen.
Agreed.
I'm looking at something that Eric Matai put up there. Hey, Eric. It says, he wrote, how can we empower modern ODs to be more proactive? And it occurred to me that, I think there is 2 major areas here. You have the companies that are advertising our services for much less than their value, like we started to talk about. And then you have ODs in practice who can pick and choose the plans that they accept. And a really smart financial person, somebody who I had hired as an outsourced CFO, was looking at my books and said, we had our, I don't remember, a long time ago. It may have been Jay Binkowitz from GPN, actually, I think. He said that the money that you're writing off with a company like VSP, for instance, that the difference between what you charge a cash pay patient and what they are paying you is being written off, whereas it should be a marketing expense. Because what are these companies doing? They're putting butts in your chair. All you're taking the reduced fee is to fill up those spaces. And as such, when you look at it that way, wouldn't you be better off seeing less patients for more money? In other words, not taking these plans and seeing less patients, but charging, what I refer to as spending that money marketing to independent loyalist patients who really don't want to go to the retail place down the road and want to see someone like you. And then you see less patients for more money. And this is an area in business education that we lack. Maybe it began at the optometry school level or in those first few years that we came out, but it kind of sticks with us. So I see those as boiling that as 2 different problems.
It comes from fear of inactivity. So everybody goes into their practice. They want to fill the book. They'll do it any way they can to create the activity. And then, their practices get mature enough at some point where maybe they can sit back and say, hey, I don't need to be everything to everybody anymore. Let me start thinning out the herd. But everybody uses the plans to fill the book and then wants to boo-hoo the plans to upgrade their practice, so to speak. It's the devil in it.
Well, you all are really authentic and insightful, but we've got somebody joining us that can bring a little insight to this conversation. Jim McGrann, welcome to the Authentics live stream.
Hello, Jim.
Hey, Jim.
Unmute, Jim.
I thought Scott was going to unmute me. Sorry. Thanks, Scott. It's great to see everybody, and it's an honor to be here with this amazing group and to follow your last guests, Marge and Howard. So thanks for the invite. I really appreciate it.
You bet. Jim, you're president and COO of Percept Corporation. Happy to have you. Tell us what you're doing there. Could you just give the audience also sort of the mini blurb of where you've been involved in this industry? Because not everyone knows it.
Sure. Yeah. So I'm an engineer by training, spent the first third of my career in IT consulting, joined Marchand Eyewear in 1999 as their first CIO, Chief Information Officer. That's when I first started working with Ed. One of the best things that happened to me in my career in eye care. Just trying to soften the group up so that everyone's nice to me as we go through this. I'll say something nice about everybody as I go around. No, so I joined Marchand in 99 and then spent 10 years there as we were expanding, both the frame company and the software business. And then we were sold to VSP in 2008. and spent 8 years at VSP in different roles, merging Eyefinity and OfficeMate and leading that division, and then was the chief technology officer for a bit, and then ran VSP Vision Care from 2011 to 2015, and then became the CEO of what was VSP Global and is now VSP Vision back in 2000, end of 2015, did that for a couple of years. Then came back to New York and did some consulting in private equity, got connected with the guys at Nordic Partners who were rolling up the buying groups within the industry. So I worked there with them for 5 years. We rolled up the 5 largest buying groups. We added PECA towards the end, and then we sold that business to VSP actually last September, and then stayed on till the end of the year, and then started with Percept in February. I had been on the Percept advisory board for about 5 years, and they asked me to come on board as they're commercializing their products that they've been working on for the last really 20 years of IP development and 10 most recently.
You've been around it all, right? You've given doctors guidance with your buying group and PECA role most recently. You've been there to talk to doctor groups and doctor advisory boards when you were with VSP. What in the world would you say, right? I've got a list. I'm on 7 items as to how we got here.
I was listening. I listened to all of you as I was in the green room waiting to come on. And for me, the thing I've absolutely learned over the last 25 years, and especially in my time at VSP and then my time with Healthy Eyes Advantage and PECA, is optometrists and optometry provides enormous value to the healthcare continuum, right? Such an important role that, as you all said, no one really knows about. And what I used most recently is my good friend, Dr. Justin Manning, who you all know, who's at PECA, gave me a statistic a few years ago of, in 2017, I think the number was optometrists uncovered 500,000 cases of diabetic retinopathy in people who didn't even know they had diabetes. So, I mean, that's it's awesome that they found it and that they got the treatment going, but it's amazing when you think about our healthcare system that it took them getting a comprehensive eye exam to find this out. And optometry plays such an important role because I think people are most likely to go and see their optometrist, and you uncover these things like diabetic retinopathy and high blood pressure and high cholesterol in people who aren't seeing their general practitioners. And it's such an important role. And in talking to Jay, Jay gave me an overview of his talk that he's been doing lately. And there's just going to be a shortage of doctors to see people as the years go on. Aging populations, higher incidence of eye disease, and ODs are going to just play a much more important role. So it's sad to hear, ODs not thinking highly of themselves. They should start, puffing their chest out and being like, listen, we play a key role here. We help reduce healthcare costs. And one of the key messages we used to, when I was at the VSP Vision Care business and we were, selling vision plans, one of the things we talked about all the time was this study that VSP had done with HCMS that showed for every dollar that a company spent on a vision plan, meaning get their employees to use their vision benefits and go in and go see their eye doctor on an annual basis, they were saving $4 in overall healthcare costs over a 2-year period. And I don't know I just don't hear that talked about enough. And that stat that Justin gave me, I mean, these are critical numbers that every OD should be, talking about and should be proud of, and the fact and the role they're playing in healthcare. And I heard what Alan said before about the managed vision care plans, and if you view them in your practice as a marketing arm, I think that is a good way. But the other thing too is, and it was something we'd been working with the AOA when I was, before I was in the vision care role and while I was in the vision care role, we kept trying to talk about use the vision care plans and the comprehensive plans to get medical patients into your practice. And then those patients would become medical patients going forward. We never wanted the managed vision care plans to replace the health plans, but the managed vision care plans were driving that traffic. So there is so much to talk about here. I agree with what you all were saying. And to me, the most important thing is having people like you, leaders in the optometric profession, having a seat at the table and discussing with the managed vision care companies and the National Association of Vision Care Plans, and talking to them and having them really understand your position and not have it be a political battle, right? We already know enough about this in living in the country, right? No one's talking to one another. We're not getting anything done. And we know it's always somewhere in the middle that we got to get to so that we can get stuff done. You really do have some terrific people, in the managed vision care space, Kate Renwick Espinosa and Melody Healy at VSP, Matt McDonald at IMED, John Ryan and Lori Archer at United Healthcare. These are, if you haven't met them, you should, and they're amazing people, and they do have the care of the patients and the industry at top of mind as you do. But there's definitely different perspectives, and getting and sitting at the table and having those discussions, I believe, is really important.
Hey, Jim, what would you say to somebody who asks the question of hearing what you just said, which I appreciate those comments of value that we provide to the profession, but what would you say to somebody who asks the question, why isn't someone like VSP increasing reimbursement to us as the cost that everything we do to deliver care is going up, our wages are going up, the cost to buy equipment is going up?
Yep.
Can you just reflect back on your VSP days and sort of from your experience and your perspective, what is that barrier to support the providers in the industry that are delivering that care?
Sure. I mean, I think it's probably the question I answered more than any other question in my time at VSP was about, raises for the doctors. And, the number one question is, hey, Jim, have you gotten a raise in the last 10 years? And in the beginning, I wasn't really sure what that. And I was like, well, yeah, of course I got a raise. Well, we haven't. And it's gone on for too long. The challenge is, and I think Dr. Stewart said this earlier about, the problem where this all came from or stems from is competition. So back in the day when VSP was the only game in town, I think at that point, VSP was keeping rates at a level that doctors were happy with. There was, it was optometrists that founded VSP. So, created a business that was for optometry. But then what happened as competitive plans came into the market and started offering lower eye exams, the doctors really do have to take some ownership in this. And the ones that were accepting every plan, then it got really hard for VSP to walk into a client and say, oh, by the way, we want to keep your business. And they say, okay, great. Well, VSP, you're paying the doctor $65 for an eye exam. Your competitor's paying $40. You must be a really bad negotiator. So we're going to go to your competitor. So that's why I come back to it. It's got to be working together between the doctors and the payers, because again, when we talk to when we talk to the clients could always see the eye exams price and what was being paid, and that was the negotiating tactic that they would use. And when doctors in the network were accepting those lower plans, right away it dropped that, it dropped the bar, and we had to compete with that. I don't think it has to stay that way forever, but there's work to be done because all of those plans were accepted. That's the real issue. I think, it's not, it's because then in the end, again, and I'm saying this as a ex-VSP person and as a legacy VSP, most of the time when you talk to doctors, they would say to us, well, we don't want you to lose that client because, we'd rather VSP have that client than our competitors. That was what we were being told. So the only way we were able to do it at that time was compete on the exam fees and then do things like we did, back in 2010, 11, when we started to add retail to the network, because that was another competitive advantage that the other plans had. So believe me, I understand the challenge, and I don't agree with the perspective of the vision plan should just go away, because I think using the vision plans as that marketing arm, as Alan said, driving medical patients into your practice, there's a way to do it. But there has to be some work done on how the doctors and the vision care plans can peacefully coexist.
Jim, I love what you spoke about earlier, and I'm not beating you up.
No.
I love what you spoke about earlier, and I really think most folks are not as intimate with the type of studies and details you mentioned on the impact of the patients that you found diabetes with, and the impact on healthcare and the savings that ODs bring to the table. I really think there needs to be a much louder horn on that one for everybody to really, because there's just not enough of that information around the industry to begin with, which would really start giving the doctors the talking points that they need to have, the messaging that they need to bring to the table to represent themselves. But, at the same time, as I hear you talking, and I'm thinking about, big box commercial retailers as well. And here's Eric making a comment about Modern Scope is frontline healthcare. When you balance between what vision care, what plans are doing, or the fact that Medicare really hasn't given ODs any kind of significant raise in the last 15 years either. And then eyewear keeps going down, and contact lenses, we have to charge less, and lenses we charge less. When you think about this swirling effect, and then add to that the commercialism of free eye exam, it's like, where do you dive in? How do you have a constructive path towards supporting and enhancing the value that ODs bring to the table on one side, and the other side say, hey, there's a drought, and the ODs are worth more than they even understand, but we're still giving it all away. It's like,
right. I know.
How do you make sense of it?
And I know we're probably all sick of hearing it, but for somehow, and this is, you're going back 50 years or more for me, where I was trained since I was a little kid that I better go to the dentist twice a year or my teeth are going to fall out. But I was never trained that you should go get your eyes checked every year, because I think you'd rather have your teeth fall out than a problem with your eyes. And I think it starts, Jay, and we've tried, when I was on the Vision Council board, and I know they continue to really try, Ashley and the team there, is try to come up with a consumer campaigns to make the consumer understand that the eye doctor, the OD, their local independent OD, is much more than, I can go to the movies and see the TV better, or I can drive better at night. It's all about your overall health and wellness. And, when you talk to consumers, when they do the surveys of consumers, they talked about the senses and which one they'd like to lose least. It's always their sight. It's always number one. Well, then you should go see your eye doctor every year, like you go see your dentist twice a year. And it's a lot less painful. It's kind of fun. And you bring in the fashion aspect of, if you wear glasses and you're buying new frames, it's a much better experience. And we just have to educate the consumers. And, I guess it can start with the doctors, educating their patients. And I know, most of you, and I'm sure all the docs that are listening, they do that good job of keeping them coming back and recalling them. But it's the rest of the population that's not coming in. And you have half the population that are covered by some form of vision care, the other half that's covered by nothing. And the ones that have a vision plan at least are twice as likely to come in and get an annual eye exam than people who don't. People who don't just wait until they have an issue, which is not what you want to do. So it's really, to me, all about consumer education and what is the best way to do that.
Jim, in 2002, I was part of a really interesting group that AOA appointed to try to study former President Carter's challenge to optometry to do better in messaging parents. And what came of that, as we all know, is the AOA's Infant C program, the idea that optometry would step in at the first year of life and say, we're going to give it away to the patient, even if they've got healthcare coverage, because we really believe that we need to complement what a pediatrician's doing, not because they don't do it great, but because we're the eye people. And we didn't necessarily embrace it the way we could have. And I sometimes wonder, should we have created diabetic C, right? Should we have done something that was more broad consumer appeal? But you've worked in these organizations like HEA and then PECA, where you advise doctors. You saw what they were doing, like Dr. Manning, you mentioned, trying to motivate their colleagues. We've got a question from Andrea Hudson. I want you to comment. I mean, does it get to the point where doctors should unionize? Right? We're not here to suggest ideas, but does it get to the point where they have to represent themselves in a way to that an advocacy group like AOA can't do, or that a doctor-owned or centered organization must?
It's a great topic, and I know that it's come up a lot. Absolutely, in my opinion, the challenge today is, and we always refer to eye care professionals as IECPs, right? Independent eye care professionals. And most independent eye care professionals are independent because they like being independent. And most of the time when you talk to them about being independent, you say, well, what does that mean to you? And what it means to them is nobody tells me what to do. And they dig in and they get caught up in that independence. But the care can't be delivered without independent optometry. Independent optometry is required to not only round out every network that's trying to provide care, both comprehensive eye exams and medical eye exams and medical care that can be treated by optometrists. These plans can't survive without the individual optometrists. However, they're individuals. So they're all negotiating with these plans, as single people. It's really, really difficult to do. And they're trying to run their practice, and they're trying to pay their employees, and they're trying to, then have some time with their families. And then at the next point, we also need you to go advocate and have a seat at the table with the managed vision care plan. So, when we sold the PECA organization to VSP, we got, obviously a lot of questions, some people unhappy about it. And I think one of the most important messages was, for me, PECA now being a part of the VSP organization gives independent optometry a seat at the table within that VSP organization. You have people like Dr. Anderson and Dr. Manning, and they're all, Justin and Lance and the rest of the optometrists that are part of PECA, and they're able to voice and have a seat at the table. I know it's a small part of the overall industry, but I forget I remember hearing this at an industry presentation. It might have been the AOA, it might have been at some other executive, but I use this quote all the time. You want to have a seat at the table, because if you don't have a seat at the table, you end up on the menu. And I think that's what's been missing right now, is that there needs to be more independent voices at these tables, at these critical tables, like NAVCP, like all the vision plans, and explaining, they don't want independent optometry to go away, and independent optometry shouldn't want them to go away. But I understand the frustrations of not getting a raise and not being able to, leverage it the way you need to. That has to be fixed. But the only way it's going to be fixed is sitting together and having those detailed discussions.
If you ask a question on the other side of that coin, and most of us had this experience. So if we said to every OD, owner, associate, 1099, whatever the case may be, spend $2,000 a year extra, and let's finance some campaigns. Let's finance some efforts in order to go to the consumer and make them understand what we do, or some initiatives that are going to create a collaboration amongst the independents. And all of a sudden somebody says, spend $10. Whoa, wait a second. I just want to complain about this. I'm not interested in spending any money.
They won't pay that for us to go to the Capitol.
Was that Scott?
They won't pay for that for us to be well represented at the Capitol.
I know, and that's what's so frustrating.
If you think about, if you think about some of the more powerful lobbying organizations that are out there, right, like the AARP, they're, I know it's going to be hard for you guys to believe, but I am an AARP member. And it's shocking, but I am. And every month you're getting hit with, hey, we need to save Medicare, need to save Social Security, need to save, and they're looking for $2 here and $5 there so that they can keep fighting the battle. There needs, and I don't want to put this in the terms of a battle, although maybe it has to start, in a battle at first. Although the battle between the managed vision care plans and the AOA, in my opinion, really got nowhere. We've spent 10 or 15 years in this argument about managed vision care plans go away. Then we become medical, and then you talk to people from the medical, and they're like, we don't even think about, we wouldn't even give optometry a minute in that discussion. So we need to work together. So that's why I hate to term it as a battle. It's getting together, getting the right people at that table to say, what do we do for the future? Because we need the profession in the future. And Jay, I think your presentation goes a long way to showing how important that profession is to the future of the health of our country. Because people are just going to need doctors to go see just to take care of their overall health and wellness, which those statistics we talked about earlier show that optometry plays a key role in that. But, ask your average consumer, they don't know that.
Right.
Jim, you've made some great points, and the time goes fast. So I've got one more for you, and then we're going to let the Authentics take it from there, and we'll let you run. We talked about language earlier. We talked about things like the words routine and other things. I want to hit on a word that we haven't talked about yet on this episode, and your perspective of the impact of the misplaced word insurance on what managed vision care plans give. Yeah. I have a sense that the public continues to misunderstand because we've let that propagate. Any thoughts about the impact of the word insurance when it's not insurance?
Yeah, it's interesting because having seen both sides, right, being part of VSP and then being involved in the Healthy Eyes Advantage and PECA organizations, when you listen to some of the really great doctors within PECA and HEA, the way they almost immediately, when a managed vision care patient comes in, they'll almost immediately explain to them that it's not insurance, it's a prepaid discount plan that you've signed up for, and here's what that covers and here's how it works. Now, it's a shame. It's another thing I used to get yelled at a lot about, that practices have to educate. Jim, why are we having to teach your members about your plans? And understood, it's just the benefit managers in the companies that buy these managed vision care plans have them lumped with other insurance, have them lumped with medical insurance, vision insurance, and medical, dental, and then vision is a third. And honestly, those sales teams do a lot of hard work to keep those managed vision care plans because they get very little time to talk about it. But you're right, it's a prepaid discount plan, and the practices that set it up that way, I think, do really well with it. They say, they're not afraid to show them, okay, this is what's in your plan. But then the people tend to go, oh, well, I really would rather have that, or that's nicer, or I want that, that branded product. So I think it's being transparent and explaining. And the shame is that it falls on you and your colleagues to have to do that education.
Jim McGrann from the Percept Corporation. Watch for great things coming from that organization. The Authentics thanks you for your participation.
Thank you, Jim.
Thank you all. So good seeing you all. Can't wait to see you all in person soon.
See you around, Jim.
Thanks,
Thank you.
Bye, Jim.
Hey, I knew that he was on AARP. He looked like he was on AARP. What's that about?
Hey, let me ask you a question. So Jim said, he told the story of vision plans. And I would want to ask him this, but he had to go. And then he talks about how the race to the bottom and how we got dragged to the bottom in this race to the bottom. How much of that was because these plans started competing each other, selling retail products? And do you see something similar to this in medical insurance, where they're competing for lives, but they're not necessarily competing for any retail sales? And you have to go there when we talk about this. How legal is that? And, this has been something we've thrown around for a long time in optometry. Go.
That's the second time tonight I've heard us talk about the impact of retail, right? This is a healthcare profession that does incredible things. The data can be stacked up 15 ways for our benefit, but we're competing on a retail basis. And when managed vision care plans cover much of what they provide in terms of benefit to the patient that gets it from HR, in the form of reduced costs on hardware, it's really hard to have a conversation about the doctor being a valued asset in that conversation, isn't it?
Yeah, the other thing I was thinking about as he was sharing that is, and Jeff Palmer in the comments said this, which is some of these discount vision plans, we end up treating medical care underneath these plans a lot of times just out of convenience. You got a routine eye exam, whatever that is, and somebody comes in, they've got lid disease. How many times do we spend time trying to deal with that? So I think we're kind of our own worst enemies sometimes, and we're allowing ourselves to to care for patients under these discount vision plan umbrellas and providing care for things that we probably should be doing under medical insurance. So that was the first thought. The second thought I had is I have gotten a little bit in my office on a tirade on our weekly staff meetings about certain banned words in our office. And those words are things like vision insurance and eligibility and allowances and all that kind of stuff. I think we're self-defeating when we use those terms. Back to your point, Scott, about language. Those words that we use set ourselves up in some cases to lose the battle with the patient. And so understanding what these plans really are, membership plans or discounted plans, and then framing it that way, I think will take us at a much further place than falling victim to these, what we think of as vision insurance.
I love Jim talking about prepaid discount plan.
Yeah.
Right? That language is strong.
Yep.
But I also buy what he's saying, that these plans are putting the patient on the tee for us to do medical care. To your point, though, so many of the patients misunderstand the issue that they expect the lid disease to be managed as part of that visit.
The word insurance inherently to a patient means free. And so instead of asking a patient, what's your medical coverage, we say, what's your insurance? We should be saying medical coverage. Or, managed vision. Do you know what your vision care plan is? We should call it a vision savings plan. Or, years ago, I was doing a talk with Mark Wright, and, I'll take credit for it, but he said it. But, and he used the word contributes. And when he used the word contributes, it was like an aha moment. When patients come in, you tell them, okay, your plan contributes towards everything you need today. It's not everything is free today. So, much to what Jim said, what Mick said, what everybody's saying, we beat ourselves up. We cause our own problems very often in just how we communicate with the patients.
Here we are back to verbiage again.
Yeah.
My question is, though, where does it end? If he, and I appreciate it is a business, and I appreciate his point of view on VSP's point. If they're getting undercut by their competitors, how does that ever stop? That's my question. If there's always this competitiveness between what an exam is paid, what can we do if we're doing everything right, and then the company meets with the vision care plan and they say, you're paying them 65, this pays 40, and then this one's paying 20. I want that one. How do we can do everything possible to educate patients, but how do we go against that if that's happening?
Well, I mean, these are high profit companies, right?
Right.
And there's plenty of cheddar to be spread around at the table, but at the end of the day, it was a shareholder started organization. Doesn't really take care of the broad base anymore. There's no form of revenue, profit sharing. If you really wanted to do it right, if you could make something on the other side, but understandably, they're nonprofit in a way, but it's a highly profitable business. And that's why I think doctors ask like the doctor did in the thing. It's, is there something that they have to do like unionizing? And this is the disclaimer. Make sure everyone hears it that's attended and listens to the live stream. We're not here recommending you do any of this. We're covering these points. But when somebody asks a question like unionization, I think it's because they're wondering, how do I represent?
Well, and Jen's talking about a race to the bottom, right? So at the end of the day, this becomes the race to the bottom, which has been catastrophic for all of us in so many ways. So Steve Leeds posted in comments here, just as someone is always telling a story. So if you're not, then that someone else is, right? And he talks about the Pearl ads. Nobody cares for eyes more than Pearl. And with the young girl hitting the baseball because she has proper vision with her new glasses, and that emotion drives the tactical OD's need to tell this kind of story. We don't do that. We've got 2 for $99, and that's it. And a free eye exam. That's the marketing that's out there.
And programs like I Deserve More, which the AOA is running right now. When we did start the infancy program with the AOA, we studied in the American Journal of Public Health a really interesting story that was put forth about how the dental organizations and dental product companies agreed in the 50s and 60s to put the ADA seal of approval on things like toothpaste. And what came along with that was a message that you need to go get your teeth checked every 6 months. And so there is this need for a collaborative effort. And if Jim's right, and we need to talk to the Association of Vision Plans and the AOA and others, again, that's our motivation here as the Authentics, is to tell you in the audience, please go do something to start getting folks to dialogue, because we need a program that helps the patients get it. They don't get the language that we're using.
Even the thought of, what's an eye specialist? You got to see your eye specialist. As far as I'm concerned, the optometrist is the eye specialist. They're the ones who are really finding what's wrong with the patient. Of course, you're going to refer them out to someone who has a specific forte in one of those areas, but the optometrist is a specialist.
Essence, say what you just said here. What this is interesting.
No, I a lot of times when I speak, I say that we do need a rebrand, and I don't think in the way that we're valuing ourselves that us as the eye care providers, or even in our staff, there's a lot of times some questions come up and they're like, my staff doesn't even come to my practice to get seen or do their families. It's like, that's kind of very telling if we're not being good marketers and publicitors of our profession. Like the AOA, NEI, all of them can get together and put all of these great programs, but a lot of times those programs sometimes don't seem to leave the eye care space, and we're not getting them out into the mainstream, or we're not supporting them and using those materials on the platforms that even we have. But then yet it does kind of come back to us complaining about what we don't. And I do think that there's a little misery loves company in that piece, that our profession, admittedly so, there's a lot of complainers out there. And then when we give solutions on how to do things differently, it doesn't seem to always take on.
Yeah.
So go ahead, Jake.
I was going to say, I was reading Jeff Palmer's comment, call them eye doctors. And yet, we had an incident not long ago where they were trying to eliminate the name doctor. So, there's a lot of influences out there for all kinds of reasons. But if optometrists don't stand up for themselves, then they can't complain about anything. If they're not willing to stand up and finance what's necessary in order to perpetuate their own image and the services they provide, then they don't have a right to complain.
I do think it's important that our colleagues understand that you can take control of your fees in your practice a couple of different ways. And I do have some content that I can share from a friend. It's an expert in this, and I think I'll play that before we're done. But you have to use really clearly guided approaches to developing your fee schedules for everything you do. It can't be guesswork for visual fields and OCTs and everything else you do. And that blends into dry eye management, myopia management, vision therapy services, low vision services, anything that patient or payer is going to pay for that's not a patient. Use good, clear, sound processes, and understand that market-driven exam fees can be different than that. And you can choose to charge whatever you want for a market-driven exam fee. And you can tell those that don't want to pay it that you choose not to take that money from them. In other words, we're not telling you what to do, but you should be willing to stand up to people that aren't willing to pay you what you deserve.
For years, with all the other consultants out there, the great consultants, the Neil Gelmards and Mark Wrights, I mean, the generation, and of course, they're all much older than I am, but the generation of great consultants that this industry has now and has had in the past has all said the same thing. See less patients as soon as you can, and get more value in that relationship with the patients that you have, right? So it's not about see more patients, see less patients, make more money. That's really what it comes down to. You don't have to see 50, 60 patients a day. So really adjusting your fees and adjusting your services and properly marketing yourself is where the magic happens.
Well, I've always felt like the unique thing about optometry is the blend of medical and retail is both a blessing to us because it allows us to weather some of the potential storms that are out there, but it also is a bit of a curse because it requires us to have some sophistication in running a store, if you will, that most of us don't have. So we already don't have the business acumen coming out of school. We all know that. So we're trying to learn to run a business, and now we're also trying to run a retail operation. So on the one hand, it's great that we've got the retail component. That's what keeps us in business. But on the other hand, it's one more layer of sophistication that we need to have in running our practices. If you're independent, you've got to know how to run a retail store. You've got to know how to manage inventory, control your costs. So it's really, it comes with both sides.
Yeah. Jeff Goodeman's making notes in the comments, but basically how the industry optometry is misaligned in its relationships between products and services and the messaging. And that was Essence was talking about as well, about rebranding and making folks really understand what the optometrist does. And when someone says, I want to see a real doctor, they should want to see an optometrist.
How about some closing thoughts from y'all? Who's got who wants to take the floor first?
Well, this is a conversation that's been going on for 10, 12, 15 years. So I don't know if unionization is the right approach, but there's got to be something dramatic or drastic, because I mean, I've been at VSP, at GPN, we have this conversation on a routine basis. And I don't know what the answer is. And I don't know if any of the authentics, but we've got 4 well-known optometrists here. What are the answers? I mean, what is the answer to changing all of the perception of optometry by the consumer?
I think it's 5 well-known, by the way.
Essence says it's a rebrand. I'm not feeling that's far off.
I don't think of Scott as an OD anymore. That's right.
I'll say in closing, I really appreciate Jim's way of thinking. I go on all these forums, ODs on Facebook, and I read about people complaining about these vision plans should give us higher reimbursement, and that's where the conversation stops. But I really appreciate Jim's point of view that on their side, they're competing to win their own race to the bottom. And his advice, could be that if you feel you're not being paid enough by this vision plan, don't take it. So I think us as ODs do have to have some ownership. It's very easy to just go on Facebook and complain and we're really good, or just say they should, come out and say they should pay us enough, but we, at the end of the day, go back to our practices and we do the same thing. So we have to look at ourselves just like these plans do as businesses, and they're a business and they're running that business to generate profits. So why shouldn't we take a page out of their book and say, if I'm comparing apples and oranges, I need to choose what's best for me, just like they're doing, and just like these businesses are doing when they're faced with a choice of A and B. We should be making that same choice, and we should be making that choice as a business person with metrics and financials, and not with emotion, saying we should be paid more, but I'm afraid not to take all these plans, so I'm just going to do this and I'm just going to complain about it. So I really appreciate Jim's comment. It gave me a lot of perspective. And I think if we look at them as businesses and then say, well, I should run my business like they do and really make good financial decisions, that we'll be a lot better off.
That's great, Jen. I agree with you. Jim brings so much experience and knowledge to this talk. I really loved having him here. I didn't do enough looking into this before this talk, but I do know there was a big event in Texas. This is my closing remark. A big event in Texas where the TOA was successful in moving some kind of legislation forward that limited how vision plans could manipulate pricing and product. And I know for one of the items was that the VSP Premier plan was, I don't know if it was made illegal, but it apparently killed it in Texas. Now I have Tommy's the president or the ex-president of the TOA's number. I meant to call him and get the details on this. But this is the kind of thing that we can do. We can get down to the state level and we can try and control the power these companies have in our own states, and then work from there and maybe use this Texas legislation as a framework. I'll leave it at that.
I think my answer for the night is what Jay was saying. If we see less patients, then no, we need more doctors. That's an important piece to say. I think some people think that there's not enough room for any new doctors, but everyone does have that independent right to practice how they choose what they accept and don't accept. But if we're going to be more specialized in our patient care, that we can't leave out patients that need care.
Interesting opportunity, as Jim was referring to the emerging trends presentation that I was giving, which really shows that we're entering into a drought, because we're not producing enough ODs, let alone MDs. And if you think about it, if you start dropping out of the lower plans and there aren't enough ODs, then what Essence says is really, big quotation marks. You're really going to gain back the power of how you control what's happening with your practice. At the end of the day, if you're not willing to do something about it, if you're not willing to stand up, and you just want a place where you can cry and complain about it, but never really support it in any significant way, it's so sad, too bad, right? So you've decided to allow yourself to continue to be a victim, or you could stand up and do something about it and change the way you practice and make your own set of rules. And I've seen plenty of ODs in all my years consulting really transform their practices and say, that's it for me, I'm not doing it anymore. So, as much as we start out by thinking about what's going on around us, ODs are still not taking responsibility for what's taking place in their own house.
Yeah, I mean, from not having a clear focus on the messaging that we use, to the impact of retail, to the language that's used in our industry, everything from the words insurance to routine, low self-esteem, and trying to pick ourselves up by our bootstraps. We've covered a lot of ground today, and I hope that the audience has enjoyed it. One more time, if you've paid attention to the session, you like this, and you want to get notified in the future, subscribe. We'd love to have you at future sessions. For all of you who commented, the comments we didn't get to, sorry about that. We've been taking them in. We appreciate it. There's a lot of you here that are helping us have this conversation. And until August, that's it for the Authentics. Say good night.
Thank you.
Good night, everybody.
Thanks for being here. Till next time, we're the Authentics.
Appreciate you guys.